Hello from the Center for Livable Cities and a warm welcome to the 14th episode in our CLC webinar series, Cities Adapting to a Disrupted World. I'm your host, Dinesh Naidu. Today's webinar is titled Aging Well in Post-Pandemic Cities. But before we get into that, let me go over some housekeeping. Simultaneous interpretation in Mandarin is available for this webinar. To access this, please click on the Interpretation tab on your Zoom toolbar and then select Chinese. We have two speakers for our webinar today. Dr. Kiyota, founder of Ibasho, will first share her perspectives on how the pandemic has affected the aged in different countries and how these inform focus areas for the future. Ms. Charlene Chang, Group Director of the Aging Planning Office at Singapore's Ministry of Health, will share Singapore's approach to aging well amid the pandemic. Michael Koh, the Executive Fellow at the Center for Livable Cities, will moderate the dialogue and audience Q&A. We've received questions for the speakers during registration, and you can also pose questions to them now using the Q&A tab. This webinar also marks the launch of the latest title in our Urban System Studies series, titled Towards Aging Well, Planning a Future-Ready Singapore. This USS documents Singapore's journey in planning for an aging population and the initiatives undertaken since the 1980s. The publication highlights key paradigm shifts and the evolution of Singapore's policies to remain relevant to changing needs and social demographic trends, as Singapore's aging population increases with a projected 1 in 4 Singaporeans aged 65 and above by 2030. I'm now honored to welcome and introduce our first speaker, Dr. Kiyota. Dr. Kiyota is the founder of Ibasho, an organization that facilitates the co-creation with elders of socially integrated, sustainable communities that value their elders. She is an environmental gerontologist and a consultant with over 20 years experience in designing and implementing person-centered care in long-term care facilities and hospitals globally. Emmy is an old friend of the Center for Livable Cities, and we are grateful to have her here with us today. Without further ado, Dr. Emmy Kiyota, the mic is yours.
Thank you so much for the invite for today. This is the topic that I'm pretty passionate about, and it is as other people, it was a lot of impact due to the COVID-19, and I'm very excited to share what I've learned from this, and I would like to share my screen first. So for today's lecture, I decided to compile information from two sources. One, the COVID-19 report that we have put together through the Global Aging Network, which was to focus on how providers in 11 different countries responded to COVID-19 to be able to understand how they face the infection control and social isolation. And also I had a chance to talk to representatives and providers, some academics from about 8 different cities to really have informal conversation and interview to be able to compile some information about how they experience and also their ideas on how to move forward. So the challenge that we face that I've learned from the interview most of the time, there are few big themes, but the big one that it came out first was the equity issues. It's in the urban cities, overcrowding was a problem at the time of infection control. I think we do respect multi-generational houses, but at the time of COVID-19, in the insufficient housing situation in inner cities and certain areas, multi-generation was really a problem for controlling infection control. And access to services and information from low income population was very limited. And the housing condition came out. They were quite a income disparity, and that really affects not only housing, but the neighborhood where they're living in. And lots of city environments, people did have issues with transportation, I think mobility in general, especially for the older people. I've heard a lot that older people don't drive most of the time, so they will rely on to public transport, but it was just not designed for older people to begin with, but also they reduced the schedule, and also that they limited how many people can get in. So, just transportation really limited older people to go out. That created the food insecurities and the other issues. And access to healthcare, I think there is issues related to ageism. Of course, older people were most affected at this time with the COVID, and access to healthcare, acute healthcare, who is going to get treated, and all this. It's just a global pandemic hit before our discussion. So that was equity issues surface in this time. And it was a lot of zoning issues, because if we were to move forward, we really need to be very creative about what we can do to improve the city environment. But I think that zoning really created inequality to people. And this you probably heard many, many times through the COVID-19. Social isolation really came repeatedly by so many people who are involved in the city. And it's not about elders, but also caregivers, especially when you're looking after people with dementia at home, because a lot of people wanted to take their family out from the elder long-term care facilities. And they stuck at their own home, and they weren't able to go out easily, not being able to see friends. That affected tremendously. So that created the loneliness. And sometimes people did notice that it decline of cognition because it was limited stimulations. And there were a lot of caregivers burned out. And challenges, this is the biggest one probably for healthcare. It's infection control was a problem, and economic stability and security, and food security. It's interestingly, this food security came up a lot from the US based, like cities in the US, that the elders had very limited access in terms of income, and also just simple access, because I just said it was transportation and mobility was a problem. And cooling and heating became a problem. We really have to deal with the climate change issues because our planet is heating up. So, interesting finding was that, when we had a heat, like extreme heat in the cities, especially in New York, they used to have a cooling center where people can gather. But at the time of COVID, people weren't able to gather in that one space to be cool. So, but they didn't have a cooling system at their home. So that created the equity problem. It's so as cool, the heating, which is, the people who are living in the cold area. So the key lessons I would like to share, it's about 10 key lessons that I've learned from, again, this is a report we put together, just published 3 weeks ago. And this is more to do with looking at the provider's response, but I think it's relevant to the city level of intervention. So I would like to share this. Oops. So the equity and learning from experience came up. Again, I'm repeating, but it's the equity issue came up in the long-term care. There was a PPE and technology divide. Lower income countries or lower resource providers had issue with acquiring PPE, and technology divide was big because people really didn't have broadband access, or when you give up Apple computers or iPad, if people don't have knowledge to be able to maneuver with the technology, that really created divide. And you've probably been hearing about vaccine issues. A lot of appointments through vaccine, like for vaccine, is through internet, and lower income people have very difficult time accessing that. And learning from experience, this actually was one speaker interview that I had with Singapore. I thought it was really interesting comments. knowledge applicants to the future pandemic, but it's shared globally. But because Singapore did experience SARS before, and the provider said it was helpful, but we really needed to learn to bump it up. So we cannot really blindly sort of apply our knowledge, that we really have to be smart about this. And we should read, the one key lessons that I learned was protecting human rights, because I think older people in the providers like long-term care, they were kept in the room for a long time and they weren't able to go out. So we really have to think about how to manage human rights issues in terms of social isolation. And support workforce, I think it's not only acute, but the long-term care, the staff members are very, they suffered from mental health, and they really lack the mental health support so far. So I think moving forward, we really have to bump up mental health support. And I think a lot of training was done, and I think we should really look into e-learning options so that people can safely access. And adapting physical environment, it's really infection control. It's smaller size seems to be better, easy access to outdoor, and easy, just like a large enough size where people can social distance. And developing effective policy and guidelines from users' point of view. We were told many times that hospitals and elder care providers didn't feel like they were included at in the early part of the policy making of this COVID happened. So it was quite a bit of disconnect with how they can actually apply it in practical way. And it was kind of funny story, but providers were saying that the government normally issue on Friday evening for the new policies, which was very tough for the providers because they had to stay until the end of Friday to be able to comply the requirements that they needed to apply over the weekend. So that really added the burden to the staff. Advocating elders and caregivers, I think we really need a solidarity to really just lift up the elders' rights, and also that just to bring their needs out to the society and foster economic development. We've been talking a lot about economic development in our society in general, but I think we really have to make sure to include older people because they do have issues with poverty, and there are lots of people who needs to earn income. And promote social inclusion for dementia. I think dementia was it's a hidden topic, but I think the caregivers really suffered from it, and the elders with dementia didn't quite understand what was going on. So educating first responders like a police, and creating a safe and walkable neighborhood so that they can walk around, those are the things to move forward. So this is the lessons that I learned. What elders wants to have is a voice and choice and control. How can we bring this up? And moving forward, what I've learned and I've heard many, many times is that silo way of working, it is really limiting what people can do, such as like urban planning department might not be always working with aging department. They just completely divide it. And looking from elders' perspective is another one that people felt that it was missing in the city environment. So I'll just share, because I have Ibasho project, I've been hearing and being asked to share what people are doing in Ibasho project. And Nepal and Philippines, we just needed to close, but Japan kept it open because we had a nice outdoor space where people actually took their tables and chair out, and they just really gather. So that outdoor space was important. They also created, the vegetable vendor that people can actually take and leave a little, just change behind it in the box, to just so that people don't have to meet each other, but they have communicated to help each other. And also they created a bento box, and our elders are helping other elders by delivering the catering services. So again, elders want voice and choice. And I think that we really have to think about moving forward how to integrate their voices and really looking into how to develop social capital, learning from what we have. Thank you.
Thank you, Dr. Kiyota, for surveying people in all these different cities to prepare for this presentation. It's always a pleasure to hear you speak and advocate on this topic, which you feel so passionately about. It's now my pleasure to introduce our next speaker, Ms. Charlene Chang. Charlene has been Group Director of the Aging Planning Office in Singapore's Ministry of Health since April 2019, where she oversees the development and implementation of Singapore's aging agenda to bring about the national vision of opportunities, communities, and a city for all ages. Without further ado, Charlene Chang, the mic is yours.
Thank you very much, Dinesh. Just let me grab my screen up. Okay, I think the screen is up. Hello, and a very good evening to all of you here in Singapore, and to those joining us from another part of the world, a very good day to you. As Dinesh has mentioned, from the Aging Planning Office in the Ministry of Health in Singapore, and we oversee the development and the implementation of the National Aging Agenda here. I am very privileged to be here with you today to explore what it takes to age well in what will hopefully be a post-pandemic age very soon. But before I start, please do allow me to apologize in advance if you hear any screaming or pounding on the door. This is the witching hour between dinner and bedtime for the children, and the household does get a little bit hectic. So while I've closeted myself in the study, that's really no guarantee of good behavior. But I'm sure that this is something that most, if not all of you, encounter pretty frequently in this new normal of virtual working that the COVID pandemic has imposed on us. And this is actually a conversation that I'm really hoping to have in this webinar with Emmy, with Michael, and with all of you, which is really, what are the new norms that the pandemic has thrust us into, especially for aging, and how can we sustain, more importantly, how can we sustain whatever silver lining that it brings with us? So let me start off with, hold on a minute. Let me start off with a little bit of context here. I think this probably needs no introduction to everyone about the demographics of aging in Singapore. And I think from those of you from another part of the world, you have your own numbers as well. And what I really wanted to highlight for this slide is that it's really important to reframe our aging narrative. And I think this is really the larger picture and context, which underscores whatever we're doing in response to COVID, which is to reframe this aging narrative from a silver tsunami to turning silver into gold. Silver tsunami is actually really, I find it a misnomer in at least two very strong ways. And one is that a tsunami often comes on us fairly unexpectedly, whereas I don't think we can say that of aging. We know what the numbers look like. And two, a tsunami is also destructive, and I think it is not representative of the potential that aging has. So this is something that's very important to us, that we reframe our aging narrative into one that's about turning silver into gold, about unleashing the possibilities and the potential of aging. And so how do we do this? I know today's lecture is about COVID and it's about the pandemic and what we do, but I thought I wanted to take a step back to talk a bit about also what we're doing about aging overall. Much of our effort is very much anchored in the Action Plan for Successful Aging, which is our national blueprint for aging. And this is a plan that's structured at 3 levels. You can see that it's at the individual level, it's about opportunities for all ages. At the community level, it's about kampong, or a village for all ages. And, you know, just as we say, it takes a village to raise a child, all the more so, I do believe very strongly that it takes a village for us to all age well and age successfully. And finally, at the national level, it's about a city for all ages. So let me just take the next couple of slides to just run through very briefly. I thought this is would be a good time for me to just to share a bit more about the action plan for successful aging. Even as in the midst of this pandemic, we're working on a refresh of this action plan. So at the individual level, there were opportunities that we put in place for senior learning, for senior volunteerism. We introduced a national seniors health program with healthy lifestyle campaigns and activities. And we also put in place a subsidized functional screening, getting seniors to check on their eyes, their teeth, and their ears. So that's just some of the examples of what is there for at the individual level. Then at the community level, the objective is really about a cohesive home with intergenerational harmony. And here, some examples include befriending services, our nationwide community support system for our seniors, the aged care services, as well as dementia-friendly communities. And then finally, at the city level or at the national level, I think this is where a lot of the infrastructure, built environment initiatives come in. And these include the transport, the town infrastructure, senior-friendly amenities and parks. We've recently introduced senior-friendly housing. And under this pillar is also where we recognize the value of research and development in helping us to unlock the potential, not only to solve challenges, which is what's on this slide, but also to unlock the potential of aging. So on to COVID. I think, as I was saying earlier, it is a new normal in so many ways that's been thrust upon us, and the disruptions are, I think, just too many to do justice for in a short few minutes. But what it means is that it's a new operating environment, but more importantly is like, how do we make the most of this new operating environment? During COVID itself, we were very encouraged to see many examples of partnerships between community and private leaders, and this resulted in ground up co-created solutions for seniors, especially during the circuit breaker period, which a circuit breaker period where we were under lockdown. And this slide gives you some examples of what these solutions were. I think in particular, they touched on some of the equity issues that Amy raised earlier, like especially on the digital divide. So we had corporate and community partners donating digital devices. The government launched the Seniors Go Digital movement, which saw volunteers and corporates partnering each others to level up seniors' capabilities in technology and digital to overcome the social isolation and the social vulnerability that arose from the restrictions that we had to put in place for COVID. I think in particular, it was very heartwarming to see this multi-partner effort in our nursing homes, where we had to put in strict limitations on visitations. That nursing homes house our most frail and vulnerable seniors, and to protect them, we impose strict limitations and bubble wrap them, especially on visitation. And so many of the seniors, of course, were not able to go home, were not able to see their loved ones, and felt very isolated. And I think the overwhelming effort of partnerships among different stakeholders to digitally enable them in a very short time to be able to still connect back with their family members, I think was, to me, especially heartening. In addition, what we felt was really key was to level up the capabilities within the community care sector. So in the midst of all that, where the sector is very, very focused on keeping themselves and their clients and the elderly that they serve safe from the pandemic, I think what we take away from COVID-19 is that the service transformation is extremely critical. This brings about improvements in resilience and efficiency, not to mention creativity in being able to deliver what is necessary, even under very tight limitations. Technology, again, found that there's so much value in technology during this time, for the seniors, for the providers themselves, being able to leverage on technology for tele-befriending, for tele-check-in, and to ensure that services continue to still be provided, but in the digital way, pretty much like what we've had to do to adapt, webinars and Zoom meetings and all that. And what I would also like to underscore is that we realized very acutely in the past year that there was a need to ensure that we're able to reach to all our seniors nationwide. In Singapore, we have the senior activity centers, which were set up some years ago, and which primarily catered to the seniors in our public rental flats. And these seniors are typically the more economically and socially vulnerable seniors. And and of course, this is done in partnership with many of our community and VWO partners. And what we've realized during the pandemic is that it's not just our seniors in public rental flats who may be vulnerable and at risk. And actually, there are pockets of seniors all throughout Singapore. And it's also very timely that we were rolling out a baseline suite of services across all elder care centers. And this is to provide these baseline suite of services, what we call the A, B, and C. In the middle box there, you see A and B, active aging, befriending, buddying. C is actually info and referral to care services. And the provision of these baseline services would be to all seniors, regardless of where they stay and regardless of their level of income. So this was something that we will spend the next 4 years rolling out, and that we've started implementing already. And it was really the need for this and the importance of this was really brought home very keenly during the past year. And then another aspect that again was brought home quite sharply was the vulnerabilities of seniors in the workforce. And I think made us realize the need for a concerted push to provide greater job and traineeship opportunities, especially for the senior workers. And so there are a slew of different things that we're doing on job opportunities, on employment flexibility, on training, and on hiring incentives as well. And then so I wanted to also say that pandemic and beyond, we will continue to ensure that our seniors will remain resilient and supported. As the saying goes, we never waste a good crisis. And the key thing is, how do we sustain and build on the momentum that we have had no choice but to put in place, whether it's on technology, whether it's on connectedness, whether it's on community building. We want to sustain this momentum and build on it and push even further to put in place what it takes for us to age well and age successfully. And so a key part of this effort will take the form of the refresh of the action plan for successful aging, the action plan that I mentioned at the start of the slides. 6 years on from 2015, when we launched that action plan, the Ministerial Committee for Aging is now refreshing it. And as I said earlier, the key objective is to really empower our seniors and to redefine aging as a positive force. This is also in recognition that future seniors are different from our seniors today. And there are many opportunities that COVID has opened up to transform the sector and the senior landscape as well. And so how can we come together as a country, as a society, because aging is not something that it should just solely be under the purview of the government, because that would not be, it's necessary but insufficient. And so we see this as something that requires a whole of nation effort to build. And so we're doing this with engagements from Singaporeans from all walks of life. We would like to seek their views and co-develop initiatives with them. And so that's just a bit of an introduction to what we're doing on the refresh of the action plan for successful aging, which will take us through most of this year. And hopefully we would have a stronger refreshed plan to announce sometime next year. So with that, yeah, I've come to the end of my sharing. So thank you very much, and back to you, Dinesh.
Thank you, Charlene, for that presentation on the impressive work that you and your colleagues are doing. One of my takeaways is also to avoid using the term silver tsunami. Turning silver into gold certainly captures the idea of opportunities to seize as our societies age. Now, before I hand over the time to our moderator, let's reveal the results of our poll questions. We asked you in the waiting room, what is the greatest challenge to aging well in post-pandemic cities? And we can see that a clear majority, 2/3 of you felt that maintaining social connections was the greatest challenge that we will face going forward. All right, very interesting. And with that, let me now welcome and introduce our moderator today, Mr. Michael Koh. Michael is our center's executive fellow. He has 25 years of experience in the public service, including 7 years as the CEO of the National Heritage Board and 4 years concurrently as CEO of the National Art Gallery. Michael was also the former director of urban planning and design at the Urban Redevelopment Authority, where he spearheaded the planning and urban design of the new mixed-use downtown at Marina Bay, revitalization of Orchard Road, and creation of an arts and entertainment district at Bras Basah Bugis. Without further ado, Mr. Michael Koh, the mic is yours.
Hello, everyone, and thank you, Dinesh, for that introduction. Thank you so much, Emmy and Charlene, for your very warm sharing of all that's being done both internationally and in Singapore. Very touching to hear how important social connections are, and the emphasis on social capital, whereby I think in the Basho project and in Singapore, you see how community comes together to share and to look after each other, where be it through the Ibasho centers or senior activity centers. And it's also very heartening to know that in Singapore, we hope to have a sustained momentum to build up and co-develop all these many programs going into the future. Now, with that in mind, maybe I can go into the very first question that I have on my mind, and that's talking about global disruptions as a whole. I think the pandemic has shown us how it has affected the senior population in Singapore and internationally disproportionately. But how do both of you think how other disruptions such as climate change and digital disruption will affect the senior population? And on another note, in responding to this, how can we have joint responses to improve cities for multiple disruptions? Maybe I could ask Emmy for her views first, and then moving on to Charlene.
Oh, I was kind of hoping Charlene's gonna go first. Can you?
Well,
Because I started,
sure.
maybe Charlene can start this time. Take your time.
Sure. I mean, I think it would be nice if we just have a conversation, you know, just
Yeah,
a bit
yeah.
going back and forth. I think as I touched on in my presentation, the digitalization has been really a game changer for seniors, and especially so in the area of social connection. I mean, social connection, which has come up tops, you know, in terms of the audience poll. And I would want to turn it around and look at it in terms of opportunities. And how can we better harness those opportunities? There are inherent, I suppose, challenges for seniors to take up these opportunities. So for example, some seniors may not have access to the hardware, the simple just cell phones or data plans. And then beyond that, I think the last mile adoption is very key as well. I think the capabilities to be able to use it, even if you have a smartphone, I think probably in many instances, getting the smartphone or the device to the senior may not necessarily be the hardest step, but actually getting the senior to use it and to use it in a way that improves their social connectedness and social capital. I think that's quite key. And so, but in doing so, I think it really does open up a world of opportunities for seniors beyond what they may have been able to reap from just face-to-face interactions. So I think if we can ensure that the ducks are lined up, to get the hardware to the seniors as well as to get them to be able to use it properly, I think that will really make a huge difference.
Absolutely.
I was also thinking about climate change. I thought that again, looking at it from a different angle, I think given that the silver consumer market is going to be a huge one, I really think that seniors collectively around the world globally will have a major potential to make a difference as a consumer group in terms of climate change. I mean, by the middle of the century, there'll be more people above the age of 60 than by the age of 15, and some estimates put the global silver market at some $15 trillion US, and that I think has so much potential to actually make a difference in climate change from a consumer perspective. So there's just a couple of thoughts I wanted to share. I hope that's okay, Amy.
Yeah, thank you.
That's
Thank
over
you
to
for
you.
starting. Yeah. Well, I think I'm just kind of echo this climate change issue. This debate actually started post-disaster time, and I really had a strong view at that moment that we will really just try to rush into this disaster site and try to help elders. And what we've learned was that they wanted to take a leadership role to really recover from what they experienced. And also we learned that their life is much more environmentally sustainable. Why compared to the younger generation? So my point here is that maybe we can, this again, this COVID was as challenging as it was. It really, existing issues kind of came to the surface. Like social isolation was not invented by COVID. Climate change was not invented by COVID. It was there, just COVID actually brought this to the surface for people to have to see it. So when we do that, I would love to be able to see that this disruption, it's really, solution will be co-developed. I think, Charlene, you talked about this as a part of, those planning and the new action plan, but I love that idea of co-developing. I think what we've learned from the COVID is one of the big thing is that we really have to listen to people actually. Just people we are serving. Technology is great, but we're not using technology for the sake of technology. What we want to do is to connect people. What can we do to co-develop the system in the many different layers to be able to have technology as a tool to connect people and just really harness the capacity to develop the social capital is something that I thought it was interesting. And I was actually looking at the question part, and it says is intergenerational housing situations good or not? That kind of connected to this this disruption. I think intergenerational housing, intergenerational interaction is really, it's a hot topic. Everybody's talking about it, but I think it's really not about just connecting people. I think what's important is how to do it. And I think intergenerational houses are great, but the condition has to be proper. I think if it's a lower income people, has to have 10 people has to share one small house. That kind of multi-generational might not be the most desirable, but so I think this COVID, in terms of this disruption concept, from the lens of disruption, I think that we can really think about how we're going to actually do this. We kind of know what we want, and now the discussion is how we want to do it.
Right. And I think on that note, I think it's really the community coming together and training and sharing. I see it through the eyes of my own 90-year-old mother, who is living on her own. But in Singapore, we're fortunate because we have the infrastructure in place. We have the Wi-Fi enabled homes, the broadband connectivity, etc. And she was Zooming people. Church service was on Zoom, just connecting to relatives. And it's amazing how quickly she adapted to technology, just with a little bit of help. And how she looked forward to having those social connections although it wasn't physical anymore, it was over the net, etc. But that brings me to the next question that I'd like to ask you. How have cities around the world been preparing their infrastructure for the aging population? So, Emmy, you've done a whole survey of various cities, but how do you think this is happening? And the second question there is, what do you think are the trends in aging that cities need to pay attention to? The intergenerational housing issue is one, but what are the other trends that are coming about, both in Singapore and internationally? So would you like to start first, Emmy, sharing about your views of how cities around the world are preparing for
Sure.
structure?
Yeah, it's interesting because I asked the same question to the city representative, and the answer I got was that we are still in it, so we don't really have solutions. So based on that, I still share my thoughts. I think it's not really about the COVID, actually, just like Charlene was talking about. I think mobility is a problem. I think that is it's public transport and also just access to outdoor we're talking about, but it's just how to get there. It's not only a public transport, but equitable mobilities for people with, we have this accessibility code, but those are normally applicable for physical disabilities. I think we really have to start to think about what cognitive accessibility means, because we do have issues with dementia. So we really have to, I feel like looking at the mobility from different lens so that people can move around, that actually directly connects to social interactions. And I think intergenerational, it's also connected to social interactions. But, mobility and intergenerational, those are the two big issues. And I think elder care, both infrastructure and attitude has to change. I think, we had this idea of we have to look after older people in this box. And, what happens globally, that's where the infection happens. How can we actually move from there and what we can learn? And I think it's not about only an infrastructure, it is about our way of thinking. So I think, I think, like we talked about this before this lecture, how can we integrate and social capital into what we do in terms of elder care is another big issue.
Yes, and absolutely. And I think, Emmy, you also, before Charlene takes that aspect of social capital, I fully agree that cities have to prepare for the future, because the access to open space and the access to park connectors in Singapore was really a boom, because you needed to get out there to exercise even during the lockdown period. So access to facilities, and more importantly, access to amenities. This whole issue of being close to where commercial centers are, where you can get the food from in the supermarket or the local market, very, very important. In fact, it's making many cities also rethink the infrastructure. Paris, for example, is thinking about a 15-minute city. Now in Singapore, we have a 20-minute walking, cycling, and ride city, walk, cycle, ride to access your facilities. City of Barcelona is busy closing roads down to create super blocks so that they create open space out of the roads, making that accessible to the people for the future. So very exciting things happening in infrastructure. And Charlene, now maybe you can take the aspect of building social capital up, because it's a very important aspect in contributing to activating hardware that we can provide.
Yeah, thanks, Michael. I think that's really very critical. And I think fundamentally, at the end of the day, the built environment also needs to be designed around how do we increase or how do we develop more social capital. And I think this endeavor comes against a backdrop of several trends. And one is a changing family compact. I mean, in Singapore, we see that more seniors are either staying by themselves, or more seniors are going to be empty nesters with their family, not staying with their families. And that also comes together with an increasing desire from seniors as well. As future generations of seniors become more, future generations of seniors are more better educated, maybe some of them are better resourced as well. There's also an increasing desire for independence. And then actually, if you take that and look at it and balance that against aspirations of connectedness and community building, which then brings us to social capital, right? So what does that mean for the built environment? How does the built environment allow us to have the best of these worlds, allow us to, as we're aging, maintain the independence that we want to have? I mean, we don't want to be we want to be near our families and friends and loved ones and be connected with them, but we don't want to be dependent and reliant on them. You know, what can the built environment do in order to be able to facilitate that and allow us to achieve these sort of twin aspirations? I think that probably be a very key questions for cities to apply themselves to.
That, every community, every city is different because we all have different aspirations, different family ties, etc. But I do know in Singapore we've tried dual key apartments, and that seems to work, because it gives the families their own private space and their own private access, yet they can come together for a meal, etc., in the shared space. In addition to that, the Public Housing Authority, the HDB, Housing Development Board, offers grants, for example, for families who do choose to live near the parents, not next door, not with them, but nearby. And this kind of incentivizes people to come together to be in the same housing area. And I think this is in response to one of the questions one of our participants has asked about intergenerational bonding and how do we bring people together. Now, I'd like to take a few questions now that have come in from the participants. Maybe we could flash a couple of them. Okay, this is an interesting question. How to deal with the need to isolate the vulnerable and the mental health consequences of isolation and loneliness? I think it's a very good question. Emmy, you talked about how people, you know, when they are alone, then they don't realize they have less cognitive abilities, etc. They don't realize how to get around, etc. So maybe we could discuss this. Maybe Charlene, you want to start on this one first?
I think I want to go back again to the theme of digitalization that we talked about. I mean, that's I know that's come up previously, but we did see throughout the course of last year that has really been, I think, of the key aspects that has been able to overcome or help to mitigate the mental health consequences of isolation. Michael, you talked about your mother and how she's, you know, managed to get on out of necessity on these platforms and to be able to do so. And we've seen many heartening and encouraging cases of that, where we had to suspend our senior care services, senior daycare services in our facilities. Many of our providers moved very creatively into providing these things online. So while the children were at home because schools were shut and there was home-based learning, and it was the same for the seniors as well. And I sat in on sessions looking at seniors doing cognitive exercises or rehab type exercises and really getting into it and really looking forward to it. So I think the potential is really there. We've seen what I think are just glimpses of this, and I say glimpses because I think there's so much more that we can do with it. What does it mean in post-pandemic world? Do we just let go of this, or do we continue with some kind of hybrid way that will still allow us to be better at ensuring or mitigating isolation and loneliness? Because isolation and loneliness, while it's exacerbated in a pandemic context, it's not unique just to a pandemic. In normal peacetime, you know, there are people among us who face isolation and loneliness as well. And how can we use technology? How can we use this digitalization to better be able to find them and to better be able to connect with them and connect them with each other in the community as well?
And sometimes I think it doesn't have to rely on technology alone, because you can just pick up the phone to say hello.
Yeah.
Exactly, right?
Yeah.
Well, technology allows you to do it with video, which is a great thing. You can actually see each other then. Yeah.
Yeah.
Hear each other's voice, and I think that's a very important aspect to maintain that connection. Now, Emmy, any comment on that before we take the next question?
Yeah, so I think for this is a very interesting question coming from infrastructure part of it, right? Architecture. Who so far I feel like when I see that situation, I feel like we fail to provide so-called accessibility for people who want to access to socialization because we didn't design building so as neighborhood well enough that people can access to socialization. And I think the people with different abilities like cognition and physical disabilities. So I think again this COVID really brought this up. So I think we should, I think we really have to looking into like not only like accessibility for people to be able to access the services, but what does that mean, for people to be able to access the socialization from design point of view? I think this is such a great opportunity to think about that.
And also, how do you redesign the spaces of the city? Many cities
Exactly.
are renaming their parking lots and creating outdoor eating areas. So one of our colleagues who comes from overseas, he said, you in Singapore are so blessed because you can eat out all the time and you've got all these wonderful outdoor areas. But in my city, it's very few because it's cold, the parking lots, and that issue of access to public space or socialization is a very important one. Can we have the last question from the audience? Because I know time is running short. Okay, how do we balance between providing help to seniors, especially during such difficult times, while ensuring that we don't take away or even exacerbate the sense of helplessness that seniors feel from being helped? Right, both of you are the experts in this.
Yeah, I think if I could just start, I think because that's what we just try to do in the IBA show. I think we really have to listen. It means that it's not a lip service. When you listen, you should be ready to hear what they want and take action based on that. But I think co-design and co-developing a program is very important. And I think one big thing we learned is that one fits all is not the solutions. Really, I think that both policy and grassroots has to work together so that there will be a local knowledge and local wisdom that could be shared within Singapore and within like a city anywhere. But I think that it just one fits all, which is like top down to say this is what we're going to do is really not going to really work. So that's my point.
Charlene, maybe weigh in on this.
Yeah, I think it's an extremely good question. And I think it's actually a perennial one that we wrap our minds around even before these pandemic times. I think on the one hand, we want to help our seniors, but on the other hand, we don't want to disenfranchise them either. And I think a lot of it has to do with empowerment, empowering our seniors, and that is through, I think, Amy, you touched briefly on this in your slides in maybe a slightly different shape, but I really liked what you talked about, giving them a voice and a choice. Mm-hmm. I think that's very important, not to assume that someone who needs some kind of help is not him or herself incapable of providing another kind of help to someone else. Mm-hmm. And I think I would bring that back to community building. I would bring that back to connectedness as well. And I think it's a very powerful force to build communities and to connect people to each other when you help each other out. And so then it becomes more real. Relationships become at the center and at the heart of who we are and how we live. And I think that has a lot of potential to be unlocked as well at a neighborhood level, at a community level, where the help you need is not necessarily just a transactional one from a provider or from the government or from the authorities, but there's also a lot of community help. And there's a lot of like neighbors looking out for each other, helping each other out. And I think it also boils a lot down to a mindset change. It's a mindset change that just because you're a care recipient doesn't mean that you have nothing to contribute. And I think that's something that should drive how we design our policies and our programs.
And this is a wonderful inspirational message to end off with, because what you're saying is, instead of your world shrinking as you grow older, you can form so many connections that you can actually expand on your world. And you must turn silver into gold. So thank you, Emmy, and thank you, Charlene. Over
Thank
to
you.
Dinesh now.
Thank you.
Thank you so much, Emmy Kiyota, Charlene Chang, and Michael Ko for that lively and thought-provoking discussion. Thank you for sharing your time and insights with us today. All right, please look out for the details of our next webinar in our emailers. Meanwhile, this webinar has been live streamed on CLC's Facebook page, and we'll upload a recording of it tomorrow on our CLC YouTube channel, where you can find over 500 other videos, including several on the topic of aging in the city. Finally, thank you to you, dear viewers, for your participation. We hope you find these webinars useful. Before you leave, please use the QR code or link to fill in our feedback form. Do tell us what works and how we can do better. We've come to the end of today's webinar, but we will be leaving this room open for another 5 minutes. Feel free to use the chat box to exchange comments with each other and the speakers and moderator, who will be staying back a little bit. Just a little note that if you use the chat function, please indicate who the chat message should be sent to. All right. Thank you so much. And until our next webinar, goodbye and stay healthy.